welcome back to the Millennial Thermom YouTube page and online community. I'm really excited today for y'all to hear from Irene Nunez, who is going to be speaking about what she does to support new mamas, specifically using therapy. Yeah, so can you take the floor? Let us know who you are.
Yeah, thank you, Joanna. I appreciate you for inviting me here. So, yeah, as she mentioned, my name is Irene Nunez. I'm a licensed clinical social worker and certified in perinatal mental health and certified in EMDR, which we'll get into a little later, and an approved consultant for EMDR. So, as you can see, this is something that we're going to be talking about. It's a very beneficial type of therapy, and I'll get into that in a moment. But yeah, I primarily do work with women in the perinatal period, which most of you probably already know. That's like from trying to conceive all the way through like textbook says 1 year postpartum, but we know
Mhm.
it's much longer than that,
Yes,
right?
yes,
Um,
definitely.
yeah,
Yeah.
so that's like the primary population I work with. I do work with teenagers, teen parents, things like that as well. So kind of
Mhm.
a variety of different things. And I also incorporate somatic experiencing into my practice, specifically with EMDR, and I can explain some of that as
Okay.
well. But that's a little bit
Yeah.
about me. And my
Yeah.
practice is I'm licensed in California and Florida, but physically in California in North Orange County, which is like Brea. That's where my office
Awesome.
is for anyone that was wondering.
Awesome.
Yeah.
Well, I really appreciate you speaking with us. I know that that first postpartum experience for me really took me by surprise. And I think, as I was mentioning before, a lot of times when we become moms, we have all these feelings and all these needs, but we're kind of like socialized to just push it down. You're fine. And unfortunately, in this world of like toxic positivity where we can't be honest about how we feel, a lot of women do suffer silently. They're dealing with hypervigilance or on edge or all these flashbacks and just thinking like this is life now. And I definitely am grateful for therapists like you who are able to share the hope and like use all your cool little tools, like all these trainings that you do to like really help people through it. So yeah, so one of those tools that you work with is EMDR. Cause so can you
Yes.
share with the people who may not know?
Yeah, so I know it's like a big buzzword, right, in our community. It's pretty popular. I know like majority of the folks that reach out to me are like, I want EMDR, right? So you may have heard about it or not, but the acronym, so EMDR, so it stands for, it's a big, big long name, and it stands for eye movement desensitization reprocessing, right? And what does that mean, right? So a long, long time ago, the woman who created EMDR, she actually created it for trauma. And specifically, she was kind of looking at veterans. And I think that was a population that was really studied for a lot of trauma and like, types of therapies that you can do. So, one day she was walking in the park and she was like just noticing that as she was walking back and forth with her legs, she was like previously disturbed about something, and then after that she felt a lot better. She felt a lot like just kind of calm. So then she started looking into, why is this back and forth making me feel better after I was not feeling that great? So fast forward, she does research, and the reason why eye movements is in the name for EMDR is that what happens with that type of therapy is that the therapist will ask the client to bring up whatever traumatic memory they wanted to work on, whatever it may be, an image, and they use something called bilateral stimulation, which is either eye movements back and forth. It could be tapping back and forth. I'm sure a lot of you have seen that, as well as like in person. There's like something called like buzzers where you have one in each hand and it buzzes back and forth. And then there are also like other types. There's like audio that you could put headphones on and there's like a sound going back and forth. So as you all see, it's a pattern. It's back and forth, back and forth. And the science behind that really looks into the REM sleep cycle. So what happens is that while we're sleeping at night, we're processing everything through that happens in our day, whether it's talking to a friend, our work life, going to the market, all of the different things, right? So our brain is processing and our eyes are moving rapidly during that REM sleep cycle as we're sleeping. But with trauma, trauma, that's where
Mm,
things get stuck, right? So
mhm,
the brain sees, okay, this traumatic event happened. Let's pretend it's a car accident or birth trauma. Let's just use birth trauma, actually, since this is something we're going to talk about later. The brain's like, oh no, I don't want to deal with that. That's very scary in a sense that like kind of like signal to the nervous system and it kind of pushes it away. It
mhm,
doesn't get like it doesn't get processed, right? The way
mhm,
all our other memories get processed. So now bringing it to therapy, we do the back and forth, the bilateral stimulation, so we can reprocess
mm,
and it can get stored properly, finally, right? And you can
mm,
feel like, oh my gosh, I'm okay. This was then, this is now. I can let that go. I don't have to live with this anymore as like a
mhm.
trauma. Like it's like yeah, it happened, but I'm okay. It's not
Yeah,
affecting you in that way. So that's like in a nutshell, a little bit about what
yeah.
EMDR as a whole is.
I
Mhm.
love that. Yeah. And I think you mentioned at the beginning the word somatic, right? I think a lot of therapists and even doctors are starting to see like this mind and body is we're all connected, right? We can't just talk about stuff sometimes, though it can be helpful too. It's like
Yes.
sometimes we need to connect it back to like what's happening within our body, what's getting stuck within our body, and how is it
Yeah.
showing up. So it sounds
And
like really
yeah.
cool.
Yeah, and even the different states, this goes into like polyvagal theory, which you can use with the MTR, but that talks about the different states. So like most of
Mhm,
y'all already know about the freeze response,
mhm,
right? The fight or flight, right? The fawn, all of those, right? And a lot of times we're because of trauma, we're stuck in one of those and it's hard
mhm,
to really get out or and we're actually supposed to move through all of the states, right? As
mhm,
humans, right? We're going to have tough days, but
mhm.
if we're stuck, let's just say in the freeze response, that's really hard to get out of,
Yeah,
right? And trauma really does like kind of not kind of, but it really does affect us and makes us stay in these states for too long. So thank you for
yeah,
bringing that up about the
yeah.
somatic piece. Yeah.
Of course, yeah. And I guess as you spoke a little bit about it, how would somebody know that maybe they are experiencing some birth trauma effects in their life?
Yes. Yeah. So actually that's great that I already talked about freeze response. That one I see the most, to be
Okay.
completely honest, when it comes to birth trauma. And a lot of times, and this could be related to like medical trauma, birth trauma, either one, because a lot of times in the medical field, when we're having some type of medical procedure, I should say, we're getting some type of medication. In
Mhm,
particular, for birth, a lot of women get an epidural or something happens with like an emergency C-section. And there's just a lot, right? There's a
mhm,
lot. And with that, our body literally, like I'm going to use the epidural as an example because it's a
mhm,
perfect one. And I know I experienced this. And that's where, you're literally, you can't move your body, right? From like from here down. I know for me it was here down. I think for some women it's like the waist down,
mhm,
but for me it was neck down because of the C-section. And you literally can't move. So you're frozen. You're like
mhm,
frozen. And then that sends a message to the nervous system as well,
mhm,
letting it know like, oh, you can't move, you're stuck. What are you gonna do? So then you kind of begin to panic.
mhm,
Right. And then the anxiety builds up and all of that. And then, like, oh, I can't speak up. Right. And that's
mhm,
something I see a lot too that lingers postpartum after a birth trauma is like, I wish I would have been able to advocate for myself. I
mhm,
wish I would have been able to say, I'm having trouble holding my baby, or I'm struggling with breastfeeding, whatever it may be.
mhm.
But it kind of has someone kind of stuck and frozen, is kind of what I see a lot with the birth traumas.
Yeah, thank you for that explanation. That makes a lot of sense. It's like then it gets repeated to right post birth. So even if they're not on the operating table anymore or in the hospital, like that feeling of being frozen, stuck, and I can't speak, it will follow you
Yeah. Yeah.
into real life. And
Yeah.
that's the part that's like, whoa, it's wild to me.
Yeah. And we even see it in like, let's say pediatrician visits, right? But like,
Mm-hmm.
let's say there's something that the mom wants to advocate for or ask for from the pediatrician. And because of what happened during the birth trauma, sometimes they're literally stuck and like, oh, I can't get the words out. I can't ask for
Yeah,
this or advocate or even for their own
yeah,
healing, right? And that's a whole other story, I'm
yeah.
sure, like, talking to doctors about your own healing and how is this supposed to look, right? So
Mm-hmm.
C-section, how is that scar supposed to look, right? If you tear, right? All these different things that could happen. And it does send people into the freeze response often.
Yeah,
Mhm.
yeah. Thank you for expanding on that. And I do know, so let's say somebody out there hasn't necessarily heard about EMDR or birth trauma. Uh, could you just explain what are some of the reasons why people might come to you to seek your support?
Yeah, yeah. One of them is like what I just mentioned, like,
Mm.
okay, like they're having trouble speaking up medically or in their
Okay.
healing, like physically, and then they feel frozen. So that's like
Mhm,
one of them that I see often. The second most common one I see is like they want to conceive again, but they're
mhm,
very afraid that
mhm,
another traumatic event is going to happen
mhm,
if they get pregnant again and give birth and all of that. So that's like those two are like the biggest ones.
mhm,
But
mhm,
also, this is a little separate but related. A lot of times I see women who have been like sexually abused or have had some type of like complex trauma from childhood,
mhm, mhm,
and they may feel like they're fine until they're pregnant or even during
mhm,
labor. A lot of that stuff comes up again.
mhm,
Right? Or even if it doesn't come up there during the birth trauma, sometimes it even comes up like postpartum as you're parenting your child. All that childhood trauma comes and resurfaces. So that's another time I see that like a lot of folks coming in, not just for birth trauma, but also childhood trauma showing up.
Yeah,
Mhm.
yeah, that makes sense. And I think that's where like I know what took me by surprise. It was like I could try to pretend like I was all healed over here,
Sure.
right?
Yeah.
But like giving birth, becoming a parent in general is such a life changing
Yeah.
experience that you're very vulnerable in this season. And then you have like a physical representation of little mini you over there and trying not to like just do the same things that you were parented with or catching yourself and then feeling guilty and be like, dang it. I
So a
see.
lot of yeah, and I was gonna say actually that's a good point because a lot of the work I end up doing other than birth trauma and like that specific experience is like a lot of that inner child work comes into
Mhm,
EMDR for a lot of the moms, right? Like you said, a lot of
mhm,
them just reparenting that inner child so they can parent
yeah.
their child differently, break those cycles, like all of that stuff because it does. And you just said it. And I know it's happened for me too, where sometimes I have to pause and really reflect like whose voice is this? Is this mine or is this my parents' voice? You know what I
Mhm,
mean?
mhm.
Like, this isn't me, and
Yeah.
it's a lot of generational healing too.
Yeah,
Mhm.
I heard it literally just 30 minutes ago, and I was like, "Oh." And then
Yeah,
like the forgiveness, right? Like, okay, like,
yeah, yeah,
okay, I'm gonna
yeah,
try again. I'm gonna
yeah,
try again.
and with EMDR just helps really get to that. Like, we can like you said, we can talk about it, and sometimes talking does help, but EMDR really helps with getting to that root and making the connections and being like, okay, I'm okay now. Like, I don't have to carry that. It really, literally, like, it rewires the brain and the
Mhm,
nervous system, and it helps you just kind of be like, forgiveness, right? If it does come up, right? Because it's like,
mhm,
we're human. We're gonna have tough days.
mhm.
Like, parenting's not easy,
Yeah,
but it'll really help us, like, with that. Like, I'm okay. I don't have to be hard on myself. I'm
yeah,
good.
yeah. I love
Yeah.
that. And
Yeah.
then I don't want to go like too deep in
Sure.
case like it's like, trigger warning for people out there, but what are
Sure.
some examples of types of trauma that could be happening again during birth or childhood that people could benefit from seeing someone like you?
Yeah, yeah. So birth trauma is a huge, I mean, that's like a big umbrella, right? But that
Mhm,
there's so much there, right? Like I think I shared a couple earlier, like emergency C-section,
mhm,
right? That's like the most common one because you go in with like a birth plan, but then
yeah,
it's almost like a lot of times what I hear and what I've seen a lot in like trainings is it's almost like a life and death situation. It
yeah,
almost feels that
mhm,
way, either mom or baby. And that could be very scary. Another thing I've seen too is the non-birthing partner
mm,
coming to me as well because
mm,
they're witnessing their partner go through the birth trauma and they're kind of feel helpless and kind of frozen too,
mm, mhm,
even though they're not the ones physically like going through it, but they're almost like, what do I do?
mm,
Like
mhm,
helpless kind of things. I've seen that a lot of times too, it could be a lot of like invalidation
mm,
from medical professionals. So
Mm,
whether it's doctors or nurses, just really being like, "Oh, you're fine," like, "This is
mm,
nothing," and then something ends up happening because they were just kind of like, "Ah, you're good," kind of thing. So a
mm.
lot of like medical neglect as well. Wow, there's just so much that could happen. I'm just
Yeah.
really thinking, and also, like, I did see this more kind of closer to COVID where a lot of, like, the birthing person was separated from their child for, like, a certain
Mm,
amount of time because they tested positive for COVID.
mm,
Um, that's another one that was big. It's not really I haven't seen that recently, but that was something I used to see, and then, of course, the other big one is, like, NICU parenting. So which is so challenging in itself
mm,
because you can't necessarily take your baby home for whatever
mhm,
reason, right? They have to be at the NICU for a certain amount of days, weeks, months, right?
mhm.
So things like that as well. Mhm.
Yeah, yeah, that makes a lot of sense. Thank you. And I think, I mean, there's many different definitions of trauma, and I'm sure you have one, but I think like the general feeling that I get is like when there's an experience or situation that overwhelms your nervous system, right?
Basically.
So that's why like my trauma, what I experienced as trauma, you might not experience the trauma as trauma, right? Like we could have the same exact experience, and that's when like I don't like it, right? When people say, "Oh, that wasn't that bad," and it's like you don't. Are you living in that person's body or mind?
Exactly.
Like, how could you dare say that? You know what I
Yeah.
mean? It's like our nervous systems, or even just wired, even from being in the bellies, right? Like
Mhm.
if my own mother was going through certain situations in pregnancy, but the time I'm popped out, my nervous system is already at a different sensitivity level. So,
Yeah.
little
Yeah.
PSA out
No, it's true.
there.
Thank you for saying that because it's so true. Like with any trauma, not just birth trauma, right? I know this is the
Mhm,
topic here, but like
mhm,
any trauma, anything, it's like I cannot honestly stand when people are like, well, I went through that too, and you're gonna be fine. Don't worry
mhm.
about it. It's so invalidating. It's
Yeah.
just so messed up.
Yeah,
Hmm.
yeah. And it's already takes so much courage to even
Yeah.
try to talk about something that was so scary or overwhelming that for someone to shut it down like that
Yeah.
is, you know. So I think we all have responsibilities to just like hear people, validate them, but I also understand not everyone is like that kind of
Sadly,
person. So
not
if
everyone's
you
trauma informed.
exactly, there you go. So if you are feeling like, oh, I want to talk about this, but mi suegra va a decir que blah blah blah, or my father-in-law is gonna say to toughen up, then maybe like therapy is a great place to start practicing that muscle of vulnerability because you want to practice it in a place that's safe, right?
Yeah.
Then you
Yeah.
can get reinforced, like, oh, see, this is why I don't tell people anything because they just tell me shut up, right? And I'm like, no, no, no. Therapists will never tell you to shut up. I hope that, and if it when report them. Like
Yes,
if
please,
they
please.
tell you to shut up.
It's ridiculous. And then I just wanted to add one more, something I'm a little more new to this and something I'm kind of working on with some of my clients as deems appropriate is actually more like when they were born, like trauma, like
Mm.
basically. So whether that was, for example, it's more like attachment. So
Mhm,
let's say mother didn't breastfeed for whatever reason, right? They had, it's not like an obligation. We can go on and on about this, but let's
mhm,
say something happened and maybe there's something somatically where it was really hard for them to connect with their mother later on because of this. And it's not everyone's case, but if it does
mhm,
come up, a lot of times I practice with, like, for example, I literally have like a bag here of like lollipops,
mm,
and we'll do some EMDR and kind of look back at these attachment wounds with their
mhm,
mother in particular. And then I'll give them the lollipop to kind of resemble like the sucking. So
mm,
basically these like somatic
mhm,
like I guess gestures or things that were incomplete in childhood. And
mhm,
sometimes that helps. And I'll tell them like, imagine you're looking at your mom and you're staring at her eyes as you're, like sucking on the lollipop. So it's almost like resembling like breastfeeding,
mm.
for example, or nursing
Yeah,
or bottle feeding even, Yeah.
yeah, that's super cool. Yeah, it's like
Yeah.
the embodying of it again,
Yeah.
and that how healing that can be.
Yeah.
Yeah,
And
that's
that's
all.
just one example. And then another one too is similar, but let's say, for example, you were born via C-section and sometimes like you didn't get to like go through the birth canal. And a lot of times people feel stuck or they feel like kind of just like this always in their
Mhm.
life. So there's a lot of like moving that I do with them. That's the
Mm,
somatic piece I incorporate with EMDR. So that I know it's not necessarily like birth trauma, like they're not the ones giving birth, but this is more like
mhm.
them when they were born. So it's pretty
Yeah,
interesting how
yeah,
that plays a role. And it does relate too if you become a
yeah,
parent sometimes. Yeah.
yeah. That's super cool. That's
Yeah.
awesome. I love like the
So
just
like,
connecting back to our body, finishing
yeah.
what we need to. That's why I love things like dancing so much and just
Oh yeah.
swaying because it's like, oh, it's so freeing.
Absolutely. Yeah.
Awesome. So I know we're like in our last few minutes. So I guess for the last question, what do you wish every parent in the postpartum season knew? Like any specific words of wisdom or encouragement you want to share with them?
So much.
You can
It's
share
like,
as many as you
yeah, I'm
want.
just trying to choose like being more like, okay, which one, like what's like the most important, right? Or like one of the most.
Mhm.
Honestly, I'm gonna go with really basic and simple. Like you're doing a great job, right? Because we
Mhm.
don't hear that enough, right?
Oh,
There's a
yeah.
lot of like judgment, especially I hear this with like most of my clients. It's like judgments from la suegra or from a cousin or no sé qué, fulano allá, whatever.
Mhm.
And it's like you're doing amazing,
Mhm.
right? No matter how hard it feels, like you are the best parent for that child.
Thank you.
And I just, yeah, so yes, I'm talking to you too. All of us. I am talking to myself too.
Me too. Yeah.
But it's like, and it's true. And I know that's really simple, but I really, really like that's like where I start with every client, I think. Just really letting them know you're doing great. Hmm.
Yeah, I love that. I've really been processing and reflecting on that recently because I've had my moments, right? My when I dip and when I go over, and then when I feel a little ragey, I'm like, what is this rage about? And I'm still discovering it, but I do think that one of it, and I've heard it in other podcasts too, it's like caretaking is so undervalued, and the work that we do with our kids is so undervalued. So
Yeah.
just because we're not necessarily making money from raising our child like in this capitalist society we're just like,
Yes.
oh, you're supposed to do that, right? But it can be extremely exhausting, like the amount of patience that I need to not scream. it's I can guarantee most people in the government right now would not be able to handle like staying at home with the child all day
Absolutely.
long.
Yeah.
It takes
Yeah.
a whole nother level of window of tolerance and breathing and emotional regulation, all
Yeah.
of these things that we so greatly undervalue, but are the hardest things to do, and why most people would rather just like overfunction over here, numb over there. You
Yeah.
can't do that when you're right in front of a kid, right? You have to be like, all right, how am I going to respond?
Yeah.
Um,
Yeah.
so yeah, there's not a lot of people validating that and like, wow, you're doing an amazing job. Like,
Yeah.
great job just showing up and connecting. Like,
Yeah.
that's
And
like really hard work.
yeah, and with that too, like is like naming it and calling it. That's really great. So you name like, okay, the rage, right? Let's
Mhm.
pretend. Let's look for that one. Like I just blew up and that's what I felt. I'm trying to figure out where it's coming from, but at least I'm naming it and calling it
Yeah.
out. And I know that I can catch myself when it does happen in the future.
Yeah.
Cause it's gonna happen, right? We're
Yeah.
human. Like no matter how much work you do, it's
Mhm.
like, yeah, it's gonna help and have you be more insightful and more regulated. But again, there's gonna still gonna be days where it
Yeah.
comes and goes, you
Yeah,
know?
I actually did a blog post about it because I had a
Yeah,
dream the other day, and I'm trying to learn to pay attention to my dreams in case my ancestors are trying to tell me
yeah,
stuff there.
yeah.
And it was like explore the roots to understand the fruits. It was
Oh,
very, very, very clear in the dream, and I'm all about being grounded these days, right? And I was like, well, this fruit over here of rage, like, what the heck is happening underneath, right? And I think for a lot of us, it's maybe feeling unsupported, and even
mhm.
if we have a loving partner, that doesn't mean that we can still feel unsupported because parenting
Yeah,
is a job for a village, not like one or
yeah,
two people.
exactly.
Or unappreciated. So maybe I need to write myself some like love letters and ask my spouse to tell me I'm doing a good job, because
Yep.
some external validation sometimes too.
100%.
So
I think,
whatever.
yeah,
Yeah.
you hit it on the nail with that one for sure.
Yeah. So yes, you're all doing a great job, even if you haven't quite heard it yet. Especially like real life example, when you prep a whole meal and then your child throws it on the floor.
Oh.
You're
Yeah.
just like, no, not even a thank you, but not even a I'll eat it, so you have
Yeah.
to
Yeah.
remind yourself you're doing a great
Yeah.
job.
Exactly. Because it happens. And I was, it does happen. Yeah. We'll just
Yes,
leave it at
yes,
that.
that's a probably episode for another day.
Yeah.
But how can people be in contact with you, reach you, and the types of services that you provide?
Yeah, yeah. So either Instagram, with Instagram, it's like if someone reaches out, I'll send them my email, just email me instead, right? Just
Mm,
not really the whole confidentiality thing and all that. But yeah, email, my website. I think it's just flowwithitherapy.com. I'm sure you'll put it in the little
yeah,
like description and stuff. Right now I am taking a little break from clients, but feel free to reach out if anything. I forgot to mention earlier, I'm offering immigration evaluations at this time. So if that's something you're in need of, and I'm kind of trying to work with specializing with moms that
yeah.
need immigration evaluations. So that's something too. That's something you need, reach out for that. Mhm.
Awesome. So is that flowwithitherapy.com. And
Yes.
what's your email? Is it your
It's
lady?
long. It's
Okay.
Irene underscore Nunez at flowwithitherapy.com.
Okay.
Yeah.
Yeah, I'll definitely put all your information all around, but really appreciate you talking about this very important topic with us and sharing us a cool like tool for the tool belt. I think the reason this series started was just like I wanted people to know that there's like so many different ways to heal. Whatever your baby step is, like take it.
Yeah.
Whatever it is.
And thank you for doing this. Like I noticed that you've had like different types of like professionals come on and
Mm.
like all that. So it's super cool that you're doing this. So
Oh,
thank you.
good. I'm learning a lot, so it's a little bit selfish.
So it's like a
Like I'm
mutual.
still, yeah, I'm still postpartum too, so
Yes.
I'm here
Yes.
with you.
Love
Awesome. Well,
that.
I appreciate you.
Likewise.
Bye.
Bye.